Okay, hello, welcome back. Hope that you've all enjoyed a very productive and fruitful discussions in all the hubs. And I'm sure you've done that because I've already attended one of the hubs, which was the Middle East hub. I really felt the passion. I felt everyone was very eager to share all the info they have around the key challenges they are facing, coming up with brilliant, bright ideas on how to overcome these challenges. So what do you think? What do you think, Duo?
This is very true, Reem. Actually, I was in the Greater China Hub, of course, and I agree with you. The passion, the energy level was really high, but probably I noticed something else. We didn't have enough time. So I believe that's probably the same thing for other hubs. So actually, but personally, I wouldn't be too worried because this is all about APPIS, right? We're not supposed to address all the problems or issues in one summit or in one workshop. This is supposed to be the starting point of an entire journey, which we definitely look forward to partnering with all the patient communities and other healthcare leaders on the way to really problem solve, prioritize priorities, and drive better healthcare outcomes. So yeah, and then let's sustain the momentum. And Reem, I can't wait for the hub sharing. Who is going to be the first?
Absolutely, do. Let me now welcome Mrs. Ranika Prasan from the Indian Cancer Society. The floor is all yours, my lady, and we're all ears to listen to your key challenges and the brilliant ideas you've come up with for the next steps.
Thank you so much. Thank you so much, APPIS, for having me here. Today, it has been a very, very worthwhile afternoon, really, because afternoons are meant to be sleeping after lunch, actually. So it's been a very productive day for me today. And I would just like to tell you all what a wonderful time we've had in trying to discuss the 5 A's that are the basis of the healthcare system and what are the results that we've got at the end of it. I will just share my screen for a moment with you and then carry on with the rest. Now, this is the way forward that we are going to be talking about. And it's basically communication for the different stakeholders, for the government, for the PAGs, for the doctors, for the other healthcare professionals who are there. It's basically how to communicate with them, which is the forefront, which is very, very important, because it's health literacy is something that has to be overcome only if the patient is able to convey what are his true problems that he's facing, firstly, and the doctor or the healthcare professionals are able to understand them. And it's the patient advocates groups that are comprised of all the patients themselves. By adopting a bottom-up approach, we find that till they give their inputs to the government on the health policies, nothing will work. So it's very important that these patient advocate groups, that the patients themselves are able to convey their problems. And this is something that came out beautifully, how the MS Society of India amalgamated itself along with the international body only because of the patient advocacy that was there. They were the ones who pushed it forward, and today they are making demands of the government, and the government has come out with policies. These things can only happen if we all work together as one in the patient's sphere, where we are able to give the healthcare professionals the best way forward through our own inputs that we give them. If we cannot describe our symptoms, if we cannot describe to them what our problems are, how will they just understand? They cannot just understand a dumb person. Somehow or the other, whatever be our language, which can be transcribed by the local people who are there, needs to be conveyed to them. And similarly, the healthcare professionals have also got to talk about things like, for instance, trials. You talk about CA breast, and we are talking about the trials which are there, very much the new medications which are in the forefront, but they're expensive. How does the patient even get to know about it? But imagine the condition where a patient, if he is given that kind of drug, which is being, identified as a saver drug, which can help you save a life for maybe 2 years, 3 years, 4 years, isn't that a phenomenal thing? That the person has that many more years to be able to devote to her family? I think it's very important that we as patients bring this forward to the healthcare professionals, and together we all combine together to give it to the government to get the policy. This can also only come about if there's an effective collection of data, strong monitoring, and a surveillance of the systems. And there's a well-trained healthcare staff. And what's most important is the aware community, which is very, very important because after all, the onus lies with the community. Again, what came up was about the peers or the general public that has to be able to identify things like insurance and other areas from where the patient can claim a reimbursement to their expenses that have been incurred, because cancer treatment is frightfully expensive. And as an NGO, the ICS, the Indian Cancer Society, is helping disseminate information for the healthcare system through a number of initiatives besides what I mentioned earlier about the screening and the awareness and the other policies that we have of trying to identify and early detection, which is the keynote. We have the radio, which is a force multiplier, which can help to carry the message in the remotest of corners. We have developed an e-learning module on the Government of India's Swayam platform, which is free of cost, and it's enabling the lay public to learn about the cancer fundamentals at their own time and at their own pace. Then we look at a mobile app. We developed a mobile app called M Shakti on for the basics of breast and cervical cancers, and the two most common cancers which are there in our country, all about its signs and symptoms, which has been used to make the signs and symptoms of these two diseases aware for every woman in our area of locality. But we are now bringing up a version 2, which is going to be a pan-India one in 5 different languages and on both the iOS and the Android platforms. So these are some of the things that we have, which we are trying to make them absolutely digital. And we found, our polls also told us that there is more than 3/4 of the percentage of the people who polled have said that digitization is here to stay. And it is what is the way forward. We have our own Prime Minister, Shri Narendra Modi, who says that the dream of a digital India, where quality healthcare percolates right up to the remotest regions powered by e-healthcare. It is a dream, yet turning into a reality, slowly and steadily. But if the vision is there, I'm confident that it will definitely work. Thank you so much, everybody.
Thanks so much for sharing, Renuka. And next, let's hear what has been discussed in the Greater China Hub. And now let me hand over to our representative from Taiwan, Vicky. Thank you.
Hi. Yeah, 可以了吗？ Hi, good afternoon. I'm Eric from Taiwan Young Patient Association. And before my feedback, I would like to shout out to all the patient group. Thanks for your dedication to those patients. Okay, so our feedback. Sorry, we have some technical issue. Okay. 可以了吗? Okay. Okay, sorry for the technical issue. So we have some challenges during our supporting to the patients. And the first is some patients have insufficient ability to discern information. We have some delay issue. Okay. And some patients are incapable to discriminate correct from incorrect information. Therefore, they mistrust some unconventional medical or therapies. And this situation make patients request their doctors to prescribe special medication. They learn from the internet without knowing the context of medicine evaluation. And the second challenge is patient groups are often located in big cities. So we have some promotion coverage bottleneck. Patients with lower education level and lower income or living in rural area have lower health awareness and are not aware of the support provided by patient groups. So this is the second challenge of patient groups. And the third challenge is the digital capability gap in generations. Many patient groups are developing digital service nowadays, but some elderly patients are incapable of applying these digital service. So in order to solve these challenges, we have some action plans. So the first, to solve the first challenge, insufficient ability to discern information, we develop science-based and balanced contents trusted by stakeholders. We invite some doctors and some experts to co-create these content. And we try to transfer professional knowledge into interesting and easy to understand content. Many patients lack of health awareness couldn't understand these professional language. So we try to transfer into plain language to help patients to understand. And to solve the second challenge, the promotion coverage bottleneck, we try to broaden our community outreach via collaborating with hospitals or governments or regional supporting groups. And we try to develop digital tools such as websites, apps, and line chatbots to offer more convenient services to rural area. Okay, and to solve the third challenge, digital capability gap in generations, we provide multiple outreach approaches such as face-to-face or hybrid engagement model and help and develop individualized engagement experience. Okay, so so with our stakeholders. So we collaborate with doctors and medical societies. We co-create educational content and disease awareness program to help patients to understand more about their disease. And we collaborate with health organizations and governments, such as Health Promotion Administration in Taiwan. We collect disease education initiatives, and we engage as a partner in governmental health-related program, and to collaborate with publics and patients and caregivers. We create some cross-industry partnership, and we optimize the tool to deliver personalized information, and we develop some patient navigation program to solve this problem. And to summarize this challenge and our action plan, I want to use one sentence. Knowledge is the antidote to fear, and we need to try to make this knowledge easy understanding, and therefore we can help more patients to overcome their disease. Okay, this is my feedback. Thank you.
Thank you. Thank you very much, Taiwan, for the action-driven outcomes. That has been great. And now, last but not least, let me invite Joy Huri, who will present on behalf of the Middle East Hub and debrief us on the key challenges and priorities they have aligned on in the Middle East. Go ahead, Joy.
Thank you, Reem. We'll just wait until we have the
Absolutely,
slides.
until Lana shares the screen, the slides.
So we had quite a similarity from the different groups from what we see. Great, thanks, Lana. We didn't have time.
Can you
Lana.
please bring it on the show screen, please?
Lana.
Sorry, display, yes, okay.
Okay, great. All right, so I won't take too long. Just quite similar to the rest of the groups. We had a great discussion. We wanted more time, definitely. So if we want to talk about the gaps, the challenges, we focus mostly on breast cancer. So there's still a misconception that cancer is a female condition. And sometimes females themselves say, why do we have males with us in the room? So this is, it's for breast cancer, even in webinars, meetings, males shouldn't be there. So that was one of the challenges that sometimes we have. Another thing, we need to raise awareness that cancer could happen to males as well. Maybe it's not as common, but still males need to go for checkup and checks if they see any abnormality. We see in our region as well that ladies still fear having mammograms. And so we saw from the Pink Caravan initiative that, this is something they're working on to minimize the fear. Fear could come from females who have family history of breast cancer and they don't want to go, or they think they're too young, or they don't have any issues, so they don't go for mammogram. Another issue is that breast cancer examination is not covered by insurance. So that's another struggle. Also, patients find struggle for information, online information, especially when this information is not in English. For example, for the Arabic speaking, it's a bit challenging to find the right and correct information online. Another thing is that we've seen earlier that we don't talk the same language as doctors. That's what patients see. They see a discrepancy between what patient's language and the physician. So, and that's another thing, as well as we need more materials to be in the local language. Also, we've seen in some areas in our region that, patients don't read much. So they rely on any information they receive in that little time with their physician. So that's another challenge. And then, of course, we have a lower level of education awareness. Not necessarily as breast cancer is quite well known, but for other cancer conditions, we have much lower awareness on that. These are the main gaps. If we go to the next slide, what do we need to do now? What should be our next step? We definitely need to increase awareness in the society with different stakeholders. And here it's not only physicians, but also with governments. If governments have this as a priority, then we see, that the awareness is much better. We want to unify efforts on all levels. All levels here, we spoke a lot about the Middle East Council. We would love to see in the future something called the Middle East Council from each country. That way we unify efforts across the whole Middle East region, which will amplify the noise and the awareness. We've also seen here in the region that people like more patient videos, testimonials, more than just reading brochures, things like that. So the more we capture on the human part of visuals, they like that. Engaging influencers, we've seen in some conditions where we've engaged influencers, all at the same time, in the same time period, would definitely amplify the awareness. And also there needs to be an increased awareness from the newly diagnosed, from patients who have been diagnosed for a couple of years. Sometimes the awareness is very general, that we lose either the newly diagnosed or the ones who have been diagnosed for a couple of years. Then if we go to the next slide, Lana, who are the key stakeholders? Of course, physicians, the whole, nurses are very important, but we also wanted to look into patient organization. They play a very important role. Policymakers, caregivers, of course, and then pharmaceutical company. Those are the main 5 stakeholders. that are very important to be involved. What channels? Of course, social media is very popular. We see with the younger generation, podcasts are very, very popular in the Middle East as well. So if we can utilize different channels of social media, that would be good as well. Face-to-face are still very important. And then, as I said, media, all types is good. So this comes to the end of my presentation from the Middle East Africa Hub. Thank you, Reem.
Thank you very, very much, Joy, and thanks to everyone for the excellent sharing today. And now, in preparation for the second day's theme, we would like to run a small poll to understand your level of involvement in health policy shaping. So please refer to the poll question that will appear now on the screen and let us know your perspectives. The results will not be shared today, but they will be used to open tomorrow's session in the morning. So let's set the stage for day 2 discussions. So the poll here is asking, as a patient organization, or as a patient or a caregiver or an advocate, how involved do you feel in shaping health policies in your country? And here you can see the different translations in the different languages. Can we please move? Yes. Can we, is there a way to enlarge the options a little bit? And can we have also the, you can take the QR code and enter to Slido in order to cast your vote. Whether it's number 1, highly involved throughout the process and decision making, or do you feel you're moderately involved throughout the process and decision making, or somewhat involved in some parts of the process, or minimally involved in some parts of the process, and the last choice is not involved at all. Let me hear from the backstage team if the people have already casted their votes, or how long should we wait? Okay, so you still have 5 seconds to vote before we close the voting for today. So thank you again so much for providing your perspectives today. And before I hand it over to Richard Vines, I'm handing it over all to Richard Vines, please, to wrap up the day. Let me remind you before handing to Richard to fill in the feedback form by clicking the feedback button at the bottom of your screen. It's one of the widgets, the different widgets at the bottom. We really value very much your feedback to improve on the following days and in the next year as well. So please help us by filling up the feedback form.